Hey guys, on this week's Wisdom Wednesday, we're going to talk about low back disc herniations. And this is a tough one because a lot of people don't want to talk about it and they just have low back pain and they want to avoid that word called the disc issue. And I find this is really much more common than people think. In a study put out by the military, they actually found that in a healthy population and an unhealthy population of low back like MRIs, they found that there's actually the same amount of disc herniations in a healthy back, like a non-painful back, versus those who actually have pain. So where does the pain come from? Well, that's a really great question. And what researchers have found out is that when we take a disc and we have a nerve root that exits, there's actually a hormone called a cytokine that is stimulated around that nerve root that sends that signal to our brain that like, hey, we have a lot of pain right here. It isn't always necessarily that disc herniation is touching the nerve root, which sometimes it is, and then we usually get a lot of neurological deficits. But if it's an inflammatory response by the cytokine, that is why a prednisone or a taken orally or an oral corticosteroid can decrease some of those symptoms. And then the other one would be a corticosteroid injection. That is why it would work. So if you have a disc injury, here's some things you need to know. First of all, your healing is not going to be like this smooth sailing upward path. Your healing goes like a roller coaster until a better place. So if you want to use the analogy 3 steps forward, 2 steps back, that's a lot of times how disc injuries happen. And to be perfectly honest, it's not fast. Until you feel fully normal again can take 6 to 12 months, and that's a really difficult time frame for some people to put. It's challenging to work with these cases because it just takes a long time. The reason being is that disc is not very innervated by blood, and fresh blood is what helps your body heal. And so because it's not highly innervated, healing time takes a really long time. Most surgical discs are going to be in younger populations. The reason why is that disc is higher. Yes, you shrink and get shorter as you get older, and that's because that pliability in your disc actually goes down and you lose fluid as you age. So disc injuries tend to be much more severe in a younger population than an older population because those discs dehydrate. The other thing that you really shouldn't be doing is sitting. Sitting puts more pressure on your discs than any other normal activity, especially sitting with bending forward. Sitting, bending forward, twisting, sitting, bending forward, lifting, and twisting are going to be the worst. For all of you that love to play golf, newsflash, this is some of the biggest compression you can put your discs under, and then you're moving at high velocities. Now, I'm not saying you shouldn't golf, but I'm saying is you should get your body in shape and your hips moving so that all of your joints move so that you're going to put the least amount of stress on your spine as possible. My golfers hate to know that they need hip mobility and shoulder mobility so that they can create a more neutral spine when they golf. Here's a couple recent researchers put out by Nachman and Wilk, and I'm just going to show this to you. So you can see some of the different positions. Like standing is your neutral or your baseline. Obviously laying down puts less, and you can see the different positions that put a lot of strain on it. Now, when appropriate, I think the deadlift with a proper hip hinge can actually cause some of the most strength in your back. But when you have a compromised disc, that hinge is not going to be recommended because it puts a lot of stress on there. Calculated hinges, non-weight bearing or minimal weight bearing, can definitely be productive for you at that time. Some other things you need to know is that there's different rehab or physical therapy research studies out there. There's McKinsey exercises which show that you should be in extension. Williams shows that you should be in flexion. Not every disc is created equal. Some prefer one way and some prefer the other way. So that's up to your therapist to find out which type of therapy is going to be best for you when you're in the acute phase. Another thing is you can't out-exercise a bad disc. You have to be smart with exercise. I definitely think that you should be moving your body in a way that you're able to without provoking symptoms, and that's why you should meet with your medical provider to find out what should you exactly be doing and maybe what should you be staying away from. Some providers might say don't exercise at all, but I know that that can be detrimental to mental health and other components of your physical health and also chronic disease. So there's always something you should be able to do even when you're in the most pain. I've been there. I broke my back. I ruptured a disc in a terrible snowboarding accident, and I broke my back all at the same time. So this is something that took me a year to heal, and it was a long path, but I did what I could in that time to create the best healthy environment that I could, even if the disc was not so great. So just wanted to give you a little heads up about some of the things for disc injuries that you might want to know or ask your medical provider when going through that. I'm sorry you're there, but most Americans are going to go through that bout of low back pain at some point, so I just hope yours is less severe than others. That's what this week's Wisdom Wednesday.